Fascia decompression technique, what we are doing is we are working between the fingers. I'm using a wooden block here. So here what I'm doing is I'm placing the block between the fingers. Here I'll put the block between the fingers. We're trying to break the adhesions by using the pressure. So we cannot stretch the fascia. What we are doing is we are using the compression technique to melt the fascia. We'll be there for 3 minutes. We'll use the breath as a guide. So whenever there's a pain, we'll ask them to breathe in and out through the nose, 3 seconds in and 4 seconds out. What happens whenever they feel pain in these areas? You just have to be there for 3 minutes, each fingers for 3 minutes. You can try it by yourself and see the difference after you're doing. And this ankle and the hands are the distal part of your body, and it's far away from the engine, the diaphragm and a heart. That's why whenever you're walking, whenever I do a strengthening or anything, first I tend to release the fascia or decompress the fascia around the ankle. Then after that I move on to the proximal joints. So I'm working on the chain. From here, after releasing the ankle, I'll move to the calf, then knees, then your quads, then a hamstring. Slowly we'll move to the actual area where there's a problem. To melt the adhesions, to break the adhesion between the fingers and to loosen up the grip. Sometimes what happens, the plantar fasciitis which you're complaining of, it's not what you're thinking of. We have to work on releasing the fascia. Until unless you won't release the tension on the fascia or the adhesion which is maintained in the fascia or which has been there due to overtime,